This is a 2-year-old child and failure to thrive, sleep apnea. 2-year-old, just 2-year-old. And we tried maximum medical therapy for 6 months, but she's not responding. So we did some immunological test, and that was all negative. And now we are planning to operate on this patient. They showed the choking episodes, the parents. I'm going to share with you the endoscopic finding. Just see the endoscopic finding. Can you see the endoscopic finding? Hello? Hello?
Yes, sir. Yes, sir.
Yeah, now you can see that this is the choana completely blocked, and the child is choking very often. And so it's a 2-year-old kid being operated. So the first step is to introduce the, so what we do is we always go through the oral cavity, as you know. So that's the kid. Now I'm just, I'm trying to put this nasogastric tube. Lecously. See, I'm using all pediatric cup forceps. Hold the scope. So here what we do is we tie. As you know, we do it through the oral cavity. Never do it through the nose. Yesterday I saw one case. They have not done it through the nose and there's a massive synechiae. Now, because of the synechiae, the patient has got nasal obstruction. So even when you are dealing with the nose in such kids, you should be very gentle, or else it will form a synechiae. Sure. Show here. Take it out. So that's it. So in 2 minutes, I'll finish the case. And then I'll show you another nice case of cholesteatoma. Then we have a JNA also. That's a massive JNA, intracranial. You see how we have pulled up the uvula? 70-degree telescope. I'm going to start my surgery. No problem. So it is also being shared on YouTube. So you can see that. I think this will be the smallest baby with adenoid on YouTube. Now let us see. See, that's the adenoid. Now give me. So always whenever you start adenoidectomy, start from below. So use the blue. As you know, we do it completely with the ablation. We don't want blood loss at all. These are all small kids, even 2 drops of blood. Ma varla ma. Hello varla.
Not coming.
Ma, why are you standing, ma? Go inside, da. Put the no suction, no.
Suction tip.
Ready? Irrigation. Okay. Here, you can first do the first debulking and then go for the plane. Now I'm going for the plane now. See, that's the plane. I got the plane. Hmm. அம்மா 9-5 ஆன்னு பாரு. Block mom. The new one, but still getting blocked. I don't know, man. கொடு. அம்மா வேற செக்ஷன் வேணா அட்டாச் பண்றியா? பெரிய செக்ஷன். Problem, I think, is the suction. மா செக்ஷன் வேணா மாத்துமா, அது பெரிய செக்ஷன் இருக்குமா? லைட்டா இருக்கா செக்ஷனு? தண்ணி தண்ணி தண்ணி.
Irrigation.
அம்மா தண்ணி.
Sister, population irrigation வர மாட்டேங்குது.
பாப்புலேஷன் இரிகேஷன் ஏமா போட மாட்டீங்க?
That section change பண்ணி.
இரு வரேன். சேஞ்ச் பண்ணு.
அது வரைக்கும் arrange
சேஞ்ச் பண்ணியாச்சா?
irrigation.
தண்ணி இல்ல. See, I always go till the periosteum. Perimysium, periosteum junction. Very, very important. So we have to go till the, so that we remove it completely. I try to remove it completely. என்னம்மா சக்ஷன் ஏமா இப்படி இருக்கு? ரெடி? அம்மா இரிகேட் பண்ணணும். Finished. Ma, put the next case, please. I'm just going to take a little bit on that posterior vomer. That is the. This is the tubal tonsil. See that there is no blood loss at all in a kid because it's just a 2-year-old kid, right? So I'm going just above here. Now you can see how the adenoid is now very clear. Little bit here, there. Take it out. There is a small vessel here, okay? Don't cobble it here. That can bleed. There will be a small deficiency in the periosteum. So that's the final result. Little bit here. So that's the final result. Eustachian tube. So that's the eustachian tube clearly seen. So fossa of Rosenmuller is completely done. So you can see here that we usually do a complete adenoidectomy because we don't want recurrence in any way. And all these lymphoid tissues will hypertrophy, no? That is the main thing. So I hope you saw the case. It's 5 minutes, but then it's a young kid. So any comments you want to tell, you can tell me or ask.
Good
Post-op,
morning, sir.
post-op instruction, just clear nasal drops for a kid. Nothing
Sir,
else. Ah,
Sir, any need to bend the wand and to approach
what?
all the
What did
area?
you ask?
Any need to bend the wand, sir, in
Little
through
bit.
oral approach?
Usually, if it's a kid, you don't need to. But if it's an adult, you need to.
sir, what about the nasal voice the patient develops after surgery?
Nasal voice.
Yeah,
You
patient
mean
develops nasal voice.
No, the patient will have a nasal voice before the surgery. Yes.
No, after the, sir,
That is
some.
rhinolalia. Clausa will be there, no?
Yes.
That will change.
Okay, sir.
Clausa will change. Yeah. But that is not for a 2-year-old kid, boss. This is actually a thing done for failure to thrive baby. It's actually choking. I saw the choking. The parents were very apprehensive. So some say the lower limit is 4 years. The reason why I posted it is if there is failure to thrive, severe snoring, then 2 years also you can do. That is the reason why I posted this live. You
Good morning,
understand?
sir. I'm Dr. Krishnamurthy, sir.
Hello, Dr. Krishnamurthy ji.
Sir, is this the typical rose position or simple supine position, sir?
No, reverse Trendelenburg, boss.
Okay, sir.
Reverse Trendelenburg. Septum position.
Okay, sir.
Any other doubts?
Your endoscopy is always pediatric, sir.
No. This is 70-degree, normal 70-degree. This is not pediatric. 70-degree, normal 70-degree. Coblation is 9.5. I use the Bonds coblation. I will
So
not do a
Bond's regular
tonsillectomy.
wand, sir? Bond's regular wand or adenoid wand, sir? Regular tonsil wand or adenoid wand?
No, this is a tonsil wand only
Okay.
in Bonds. See,
No.
did you see a drop of blood?
No,
It's
sir.
very
That was it.
important, boss. It's very important for a 2-year-old kid. You cannot do with debrider. Many people do with debrider.
Good morning, sir.
Good morning.
Getting the plane is very much important.
I'm using copulation with adenoids right now. The same
Hey,
case.
see the
Wow.
same technique being done in
Yes.
Uzbekistan.
Yes, I'm doing. You see?
See, I love it. See, this is how the teaching propagates. Okay. So when we teach, see what happens. It propagates like this. Not here, but thousands of kilometers away, there is a student
Yes, sir.
doing that.
I'm very
Very-
happy that I'm your student.
so nice,
Okay.
Dr. Fazil. Excellent. Good. Okay, next I'm starting one mastectomy. Very nice case. Then we have a JNA.
Sir.
Okay.
Okay, sir.
All right.
I'll be with
Right. Bye.
Bye.